Used to work as an industrial hygiene officer and a senior safety and health professional. One of the things that I learned very early on in my environment is that everything depends on the culture that's set from the top. And let's talk about what it takes to create a successful public health culture and program. In order for any program that's going to be applied to a large group of people to work, whoever sets the tone at the top sets the tone by which all other individuals underneath them are going to follow. So if you have the leadership of a particular organization, whether it be a business or a school, whatever the case may be, they are the ones that are going to set the tone to let everyone know what is and what is not acceptable and what they should do in order to follow that. Every good public health program and culture has to depend on people at the very top who are going to set forth what is and is not acceptable within the scope of that organization. But every program or culture is really only as good as the people who implement it. The reason I stress this is because if you lay out guidelines for what people should and shouldn't do, but then you don't enforce those guidelines, and you leave it up to the individuals to do so at their own will, the problem that is you're going to run into a potential possibility that you're going to create more problems for yourself because you're going to have inconsistency in terms of how that program is implemented. The only way you know if something works, those programs are important because how those programs are being used is going to show you, the numbers are going to demonstrate to you whether or not what you're doing is actually working. So if you have some people enforcing it and some people not, some people doing it, some people don't, your numbers are not going to give you an accurate representation as to how well the program is actually working. That's what gets lost in translation whenever people get upset when they're thinking about all these different things. The only way we can truly identify, or you can truly identify what works and what doesn't work, is that if everybody not only implements what is being asked, but if everybody is enforcing it equally as well. So this way you can measure whether or not it's successfully working or not. Which brings me to the point of the data. Your threshold is typically certain numbers, whether it be number of occupational injuries, number of occupational illnesses, so just like in a public health arena, just the number of sicknesses, the number of injuries. Those numbers are driven by, in direct contrast to the program. So you have a baseline number, and then what you do is you implement a protocol that you think will impact those numbers and bring those numbers down. So what happens is that not just merely bringing them down, you can start looking at what works successfully and what doesn't, especially the ones that doesn't. So if you look and you notice, okay, they're doing everything right, but it's not working. What's happening? Maybe these people need to wash their hands more. Maybe they need to social distance a greater distance. Maybe the type of masks they're using aren't the right ones. The more information you have, the more you can actually make decisions that benefits the masses, which is why it's important that this attitude of gathering information and doing things from the top and people aggressively doing it and enforcing them is important, because you want that data to guide you as to what changes that you need to have made. Which brings me to the point of the change. When people implement a program, it's not just a one size fits all, or you're going to do this and we're going to keep it trucking. No, what happens is that the program they give you is a living document. They adapt it accordingly. So when they say these are the protocols and they determine that these protocols work, maybe they work in this environment, but they don't work in this environment. Maybe they work for this period of time, but not necessarily for that period of time. All of these things are useful and crucial pieces of information that you can utilize to tell you where you need to tweak your program, so this way you can get the maximum effective result and give the benefit for the masses accordingly. And in the end, it is all about the masses. Whenever you have any type of public health crisis, whether it be occupational health, occupational injuries or illnesses in the workplace, public health injuries and illnesses in the workplace, they all overlap. There tends to start with a definitive number, and you're trying to bring that number down because you want to minimize the amount of risk and exposures individuals have to those issues. So what happens is that everything, any culture or any program that you have has to operate as a living, breathing document or a living, breathing program or a living, breathing culture that takes in consideration it has to adapt and adjust itself to the various changes. Trust me when I tell you, one of the things that I used to talk to when I used to talk to employers well before my days as an attorney, your program is only as good as your desire and willingness to implement it and continue to work on it. These programs and these things that we're happening now, these aren't just things that are just going to sit on the shelf and be done one way and then we're just going to ride off to the sunset. They have to constantly be revised because as you get more data and more information, you get a better sense of the things you need to do to make more substantive changes.